Hello everyone, this is Dr. Khan, Bloomfield Hills, Michigan, Executive Plastic Surgery. So I've just completed a case, complete end block, 10-15-24, initials SL, nice lady from Florida. And so she has implants from 1990, silicone implants, which are basically were picked up on a mammogram to show what is a rupture on the right and the left. Now, a mammogram is not supposed to, but the radiologist was very detailed. You can see I removed a lot of skin in this 64-year-old lady. And as you can see, the entire implant capsule was done. On the mammogram, there was what is a snowstorm appearance. Snowstorm appearance, and you can see this is the inflamed tissue around. If I touch it and I feel it, this is abnormal. And so I removed that inflamed tissue around such that the entire end block was done in the manner where all inflamed tissue is removed. And you can see the dusky appearance. So these are implants that are 34 years old. And you can see by definition, we don't even need a mammogram to say what's the status, because they're very likely ruptured. And as you can see, as I go in, look at it's white on the inside, which is interesting. And you can see how the implant is. I just want to show how the implant is like folded up on itself. You can see how it's folded up on itself. And these are the ME implants, silicone implants. And so what I'm going to do is I'm actually going to, so some of the capsule was so thin, and I'll show this to you. So as I remove this, you can see how it's folded up on itself. And this is what I call, like in the past, the albino implant. And so all contained, look at the inflamed tissue around. You can see my blue glove. So some areas are so thin, it wouldn't take much to go into this capsule. So if I put the ruler here, you can actually, parts of it, you can read the ruler right here. You can see it says Medline over here. It's transparent. And the point to show that no matter how thin the capsule is, it can be done in the end block fashion, which is the gold standard. None of this is spilled into the chest. You can see some calcifications right here. And so all of this is contained. And this is, look at the status of this implant. There's a texture to it, absolutely texture. And let me see if I can read this. There's nothing that I see that's legible, but you can see this is an implant that is indeed ruptured. Look at this. None of this spilled into the chest. She had, interestingly, on the mammogram, and also on the ultrasound what was lymph nodes with silicone in them. So lymph nodes, silicone-laden lymph nodes. So now I'm going to go ahead and go over to the left side. Now, as you will see, I just want to highlight, I just changed my gloves. This is the Khan procedure. No lift. I'm actually very happy in this 64-year-old lady. She truly does not need a lift. No need for drains. Blood loss was less than 5 cc's on each side. So total blood loss was less than 10 cc's between the two sides. I give the high definition photos, video of the chest wall, and obviously, as you can see, cutting open of the capsule. Pathology, I do the CD30 analysis, breast cancer rule out, etc. Any abnormal pathology, microbiology, fungus, aerobic, anaerobic cultures. Number 6, twilight, deep IV sedation with propofol, fentanyl, Versed. Number 7, I return the implants to the patient so you can see exactly what was inside. And number 8, regardless of the age, the patients get the same surgery. So I removed the skin on the bottom and horizontal incision only. So no vertical incision, no incision around, so that all of that inflamed tissue is removed. Now, as you can see, look at this tissue around. Remember, she had what is a snowstorm appearance, and I'll have that mammogram report up. And you can see some areas relatively thin, and you can see the abnormal contour of the breast and the implant and the inflamed tissue. So one thing I want to point out, it is you have to remove the capsule plus the inflamed tissue around plus the implant as one system in the end block, which is the gold standard. en bloc. So I just want to go ahead and show you, look at this tissue. You can see it's dusky, it's not healthy. You can see the color of the fat, that silicone, that leaching, the inflammation has spilled over to the side. So I just want to show this tissue has to be removed. Yes, it's precious volume, but it's bad tissue. You can see, look at this scarring that you see. So this is bad tissue. This has to go as much as the capsule itself. So I'm going to go in from here. And you can see instantly ruptured implant as seen on the mammogram. Now her radiologist who read it was very smart, very nice lady. And you know, if you go back and look at her previous mammograms, and she got these yearly, you can see she's not ruptured from the last year. She's been ruptured for many years. And so this is, again, I cannot read what it says, but these are the silicone implants from 1990. And as you can see, indeed, very much ruptured. All of this contained, none of this spilled into the chest. And look how thin, again, the capsule is. You can read, you can see my green glove. And all of this inflamed tissue around has been removed. Some calcification you see. I'm actually going to cut this part of the tissue open. You can see, look at this tissue right here. This is what appears to be a focal spillage right here. Very important to see right here. See this tissue right here? It's very thick. And you can see there is extravasation of this silicone right here. It's hard to tell. I'm going to cut this open so you can see as well. So it's hard. You can see how hard it is. And you can see this tissue, very thick. And what appears to be a pocket in itself right here. So all of this inflamed tissue has been removed. And so there you have it. En bloc, the gold standard. I could not have done the surgery any better. Blood loss, like I said, was less than 5 cc's, and this is how it is in well over 99.5% of the patients. No need for the drains, and we'll see how she does aesthetically as well. I'm actually very pleased with how she came together. En bloc, the gold standard. In this case, there is no indication to go after the lymph nodes and the armpit, the axilla, because if those are removed, she's going to get a lymphedema and other problems. And so we'll see how she does post-operatively minus these toxins. Implants, as you can see, be it 10 years later, 20 years later, in this case 34 years later, she's been ruptured for some time, I do not know how long. And implants overall, ultimately, as the FDA says and as the manufacturers say, are not lifetime devices. They have to be removed or replaced at least in 10 to 15 years, which is the norm. Anecdotally, from my experience, from my practice, from my patients that I've seen, around the 7-year mark, that's when they start getting trouble, and one should start considering and looking into what to do next. And again, this is part of the informed consent. This should not come as a surprise to the patients. This is part of the informed consent every plastic surgeon must discuss with their prospective patient before an augmentation. This is Dr. Khan, Executive Plastic Surgery.